Ours is a complex sector. We work within the social services sector around assisting families and issues that are pertaining not only to the behaviours of parents, guardians, extended family, but also ensuring that their children are kept safe from all forms of abuse and neglect. The greater difficulty of our work is around, sometimes it's not always quite clear because children can be suffering from behavioural issues themselves, whether it's ADHD or autism or Asperger's syndrome, even to the effect where a child is born with deformities, where the parents find it hard pressed to care for those babies from birth right through to infant, right through to young children and even young adults in growing. It's amazing because new workers coming into our sector, certainly through what it is that we do on the ground to assist families and children, there's a great difficulty around to engage families and to point them in the right direction by referring them to specialist services on the ground. Now, those specialist services could range from a whole range of services, whether it's health issues, whether it's mental health issues, whether it's drug and alcohol abuse issues, whether it's children simply not attending school and dropping out at an early age. In most cases, it's around children when they reach high school or even year 5, 6, that they tend to think that schooling's not for them per se. The problem with that is that in this ever rapidly changing world, we all need an education to go from where we need to be as a child right through to young adulthood. The other constraint that we find in our work is information technology has taken hold around a lot of our young. It's problematic that parents would, as an example, purchase an iPhone or an iPad for a child as young as 10, 11 years of age. And it's because parents are so busy these days, either with their work and with their professional jobs, and it's hard pressed to support children simply. It's far easier in the 21st century to say, here's an iPad, go up to your room and don't bother us. So how I would advise new workers, certainly with the work that we do on the ground, is that it's a patient, resilient exercise. None of the issues affecting families these days, certainly in the state of Queensland, it has to be thought as working towards equitable outcomes, not only for parents, guardians and extended family members, but also the luxury that we have in our jobs or in our professional capacity to step into the shoes of other children. And it gives a great insight into what is plaguing families. As an example, it's estimated that 28% of our caseload is around domestic family violence. Up to 35% of our caseload is around the insidious use of alcohol abuse, methamphetamine use, illicit drug use, and about 15% of our caseload is around the behaviours of children themselves. And it's hard pressed to understand why our kids these days are sort of falling by the wayside and why their behavioural issues affecting every single member of the extended family, immediate family, social friends and family. So our work is paramount to ensuring that children are able to enter into young adulthood and thereby, with a good education, and thereby find their way in this ever rapidly changing world. So the advice I would provide for new workers within our field, take it easy, put your seatbelt on and enjoy the ride.